My name is Raj Upadhyay. I'm currently a fourth year resident at the Ohio State University in Columbus. Uh, I've been involved in radiation oncology for past several years. I got interested into the specialty because of my background interests in physics, and I see this as a perfect amalgamation of physics, uh, patient care, imaging, and I absolutely love it. There are several areas of research I'm currently involved with, some of them being brain tumors and pediatric cancers, trying to make radiation more accessible for kids across, not only underserved areas but also across the world. So that's few of the things I'm working on. Specifically, how I got into communications is a very interesting story. I see I have a lot of collaborators I meet with across the world, and I find communication is the key to really get connected to them. And as long as you are fair, you know people, you can get your things done. It's always much easier to talk to someone rather than send out an email to hundreds of people hoping someone would reply. And that's how I got into trying to make communications better for the purpose of enlightening our radiation oncology community, connecting with medical students, mentors, and seniors and juniors alike. So that's how I started loving the communications aspect. Thankfully, I got to know about this position at RTOG. I've previously worked with ARROW, the Astros resident committee, and I'm involved in their communication subcommittee for a couple of years. And we do several things, including organizing meetings at Astro and organizing the ARROWgrams, which are monthly newsletters we send out to all the residents. So that's really been my experience so far. We often don't think much how important effective communication is in our realm of radiation oncology. We talk a lot with cancer patients, and a lot of them, if you have really good communication skills, you can comfort them, and they are at a very difficult position in their lives. And then we want to enroll them in our research studies and our clinical trials. And if you are an effective communicator, if you can really hear them and listen to them first of all, and then express your whatever you want to talk to them in a manner which is comforting and more understanding for them, that's great. So that's another aspect I'm continuing to learn as a resident and as a radiation oncologist, and I would want that to be another goal of being effective communicators in our day-to-day practice. So I spent my early days in radiation oncology reading all about RTOG trials. That's my first experience with clinical radiation oncology. One of the first trials I was really admirable of. This was a study done for brain metastasis patient trying to evaluate the best dose, the highest dose they can give. And I was just amazed by how remarkable the study was. And then when I saw an opportunity knocking at the door that I could be involved with RTOG as early as during residency, I was just amazed, and I just tried to grab onto that opportunity. RTOG is a big and great organization, and most of the leaders we have in our field have been involved with the group in some capacity. And especially with my goal of trying to be an academic radiation oncologist down the line in the future, this was an amazing opportunity, and I see that bearing fruits. I was able to meet and connect with a lot of leaders in our field, and that's amazing. So this past few months as a social media intern for the RTOG Communications Subcommittee has been a great experience for me, not only in terms of meeting new people, connecting with them, sharing ideas with them, but also getting involved in some of the early work with RTOG is doing, getting to see how the trials are built up close, how people communicate in the early stages of developing a clinical trial. because of this position, I was able to attend some of the closed RTOG NRG meetings at Astro, and was able to attend the NRG semi-annual conference. And some of the sessions I attended really gave me a lot of insights on how I can go on and develop clinical trials of my own in the future. And that's one of the biggest things I take away from being a social media intern so far. Well, I still have 4 months to go and much more to learn, so I hope to do more down the line. I think getting involved with the RTOG, the organization itself, as early as you can is probably the best for you if you want to develop a career in academic radiation oncology. I was listening to this talk the other day, and I think it was Dr. Paul Gwynn. He was saying it took him 14 years to start his own trial after he attended his first NRG meeting. Well, if you start this process maybe a couple, 3, 4 years earlier during your residency, maybe you can cut short that time. Well, I don't know. I historically, I know residents have not been involved much with the clinical trials, but I think in the future, early, we are starting to do everything couple years earlier, and this is the next step. I think getting involved with the group, getting involved in clinical trials during your chief residency year, during your research year, is probably the best way to go, because that kind of starts to give you a bit more insight into what you want to do. Do you see yourself doing this for the rest of your life? Yes, why not? So I think that's my advice. If you want to work with the group, want to get involved in clinical trials, starting early is important, and this is one of the ways you can get involved with RTOG and NRG, and yeah, that's what I would suggest.